Today I'm going to talk about preparing for your future, financially and otherwise. So, today's topic is preparing for your future, financially and otherwise. And I think this is a really relevant talk at any given time. But when you've just come through a pandemic or you're being faced with one, there are things that we learned as lessons from the one that we just came through and maybe aren't finished with. We're not sure. So we have very uncertain times right now and ahead of us. And who knows, it could happen again and again. So let's look at what we learned from this one and see if we can prepare better. Because this one caught us by surprise. I don't know about you, but it definitely was not on my agenda to shut down on March 17th and not have a business for 3 or 4 months, right? And I'm sure it wasn't for you either. So what did we learn? First of all, I think the first lesson that everybody learned that was the biggest one is that how online can you make your business be? Now, practices are a little difficult this way because you are delivering an actual hands-on service in 99% of what you're doing, or maybe not 99%, but maybe 75%. For some professions, you could do virtual meetings on Zoom and virtual appointments and so on. But ultimately, the service to be fully delivered had to be done in person. So there was no overcoming that. But you could prepare for a certain amount of your business to be done online from home. Like, let's say you have your staff are able to function from home in terms of your front reception computer is accessed from away. A lot of people already had that, but most people didn't. And so having that would be really, really good. Secondly, having the phone being able to be forwarded to your staff member's house or your house, which we did, and that was handy to be able to do that. Getting your staff prepared for this sort of thing, like meeting with them, especially for preparing for the future, because we didn't have a chance to do this last time, but now you could have a one-on-one conversation with each of your staff. What do they need to do to prepare in terms of childcare and schedules and, elder care, childcare, et cetera. They should make some contingency plans in case you are going to be keeping the practice partially open and you need their help. That was not prepared for last time at all, so everybody went happily off onto government subsidization and or unemployment insurance. And so it was not, a lot of things didn't get done in the practice that could have been done while the lockdown happened, that would have prepared for a better future. There's also looking at for you, who could replace you if you got sick. Let's say you as the provider get ill. You need to make sure that you have some ideas who could sub in for you and deliver to your patients at least part-time to keep the practice going while you're off for your 2 weeks quarantine or whatever it is next time. Let me think. The next thing is we want to talk about budgetary matters, because things that we didn't prepare for was making sure we had lots of room on our line of credits and lots of room in cash, whichever you do. Some people have cash piles. I don't know who they are, but I have met quite a few healthcare professionals over the years, and most people are pretty much into their line of credit or their overdrafts. And during the pandemic that we just went through, a lot of people didn't have room on that and had to access government subsidization. We might not have that as an option next time. The governments around the world have pretty much driven themselves deeply into debt trying to support their public and keep them from disappearing in terms of businesses and so on. So this is not something that we can necessarily count on again. So having a look at what could you do to build up your line, or pay down your line of credit, let's put it that way, or build up a cash cushion, okay? So either way, somewhere where you can go for money without having to go to the bank, they're not really amenable to loaning out money when they don't know what's going to happen in the future either. Therefore, you want to look, okay, you were thinking about buying some equipment, and this equipment is going to cost XYZ amount of dollars. Maybe you should put that off if you possibly can and just pay for some repairs if it needs some repairs. that sort of thing, so that you are not expending more money than you should. We're looking at how we can cut down your overhead. Do you have redundant personnel that are not absolutely necessary to the functioning of your practice? Are they working more hours than you need them to? That sort of thing should be looked at, because if you can cut down on your staff salaries, that would be good. You might want to look at getting PPE this time ahead of time, like stockpiling a bunch right now, because if something else, if we have other waves of pandemics in the future, it might not be something that financially would be feasible to buy next time, because maybe the prices are going to go even more out the roof than they did this time. So right now stockpiling might be a good idea, and it's not wasted money, because you are eventually going to use up those materials anyway, in all likelihood. So including cleaning supplies as well, and your PPE. What else? You could look at what other expenditures you have for the practice that are unnecessary right now, that you don't need to have. Can you cut them back? Another one that's come up is, and this happened for us too, we had an option to get out of our lease, and we reduced our rent by half. And that's a very, very good thing to look at this time, to see how much you can. A lot of landlords are very pliable, quote unquote, right now, in terms of they want to keep you and they want to keep you surviving. So they're very much more open to the idea of cutting back on your rent maybe a little bit, or having some free rent months. These are things that you can explore as well. So basically, you want a business continuity plan is where I'm heading here. You want to look at what are all the different ways that you could survive another wave of pandemic in the future, because while this one may or may not be over, there are future ones that people are predicting could happen to us. And so be prepared is the biggest watchword right now, but keeping your finances as low as you can, like your expenditures per month, and then taking the extra money that you're making, as most practices are fully back to operational right now, and some are doing better than ever. Take that extra cash, don't take it all home, put some away into your line of credit and pay it down. Make as much room for yourself as you can, and use this time where you've got a breathing space to actually stockpile some possible resources should you need to have some way of covering bills for a while when there's no income. All right, so I think that's my message for today, is plan properly and we won't be caught flat-footed again. And if it happens again, it happens again, but we won't be left wondering what to do. Okay, so there you go. Make your future better. That's all I have to say, except that you should subscribe to our channel and watch for more videos, as I pretty much do 1 or 2 of these a week, trying to give you some tools and skills to help you make your future better. And give us a like and share us with people, okay? Thanks. Bye.
To get your practice analyzed, contact the Art of Management at 416-466-6217.